it's Dr. Kronowitz, and welcome to What's Hot in Plastic Surgery. This segment will talk about breast lifting or breast mastopexy and breast augmentation, or the enlargement of the breast. So what's the difference? Breast lifting or mastopexy refers usually to removing some of the excess skin in the lower breast, especially that can happen after pregnancy or aging. And we lift the breast really without adding additional components, and no implant, no fatty tissue, which leads to a rejuvenated appearance. This is often used in patients who already have large-sized breasts that really just want to rejuvenate the breast. And we have really wonderful techniques that can lead to excellent outcomes with minimal scars and can almost look like they've been augmented in many patients. So there's several types of breast lifts. Okay, the breast lift, the most basic one is called a concentric mastopexy, and what that refers to is taking out a donut of skin around the nipple and the areola, which eventually lifts the breast, lifts the nipple and areola position, and brings the breast tissue together in order to create a more youthful appearance and a tighter breast, and a very nice appearance, especially, like I said, in women who do not leave a lot of volume. The concentric mastopexy can also be combined with an implant or with fat grafting in order to increase the volume. Concentric mastopexy can be ideal for patients who do not have very droopy nipple areola complexes, where we just need to lift the position slightly to get it higher up into a more youthful position. The next type of commonly used mastopexy, which is also very popular in my practice, is vertical mastopexy. Vertical mastopexy has come along and been popularized over the last 10 years. It involves a more minimal scar on the breast as opposed to the inverted anchor, which is so commonly used. And it really allows for the breast tissue and the nipple areola complex to be perfused with blood supply on the upper part of the breast, which looks for a much youthful appearance versus basing this blood supply on the lower pole of the breast, which tends to sag over time. Vertical mastopexy as well can be combined with an implant, as referred to as a mastopexy augmentation, or with fat grafting in order to have a lift and add volume without the need for a breast implant. So I want to talk a little bit about breast augmentation now, which is very popular, especially for patients in implant reconstruction. Implant techniques can work very well. There's a variety of implants that are available that are both contoured and round, and create extremely natural results. In addition to that, I'm using just the use of fat, from using liposuction and then filtrating the fat, and just leaving the stem cells and the vascularized stroma, or the blood supply, and re-injecting it back into the breast and allowing for new growth of healthy fat cells in order to enhance the volume of the breast. This usually cannot be done in one session and requires several very quick surgical procedures, and often requires a lift as well in order to get rid of any excess skin. Also very popular, and something that I commonly use, is combine the use of an implant and fat grafting, which can lead to the best of both worlds. The implant allows you to get large volume very quickly, and by injecting fat overlying the implant, you can create a nice interface and a softness over the implant, which will lead to a much natural position. In many patients, especially who have previous implant augmentation as well, who come to my practice, I've begun to use mesh slings in order to elevate the implant, because over time, heavy implants or large implants can descend, stretching the lower pole breast skin. In order to restore them to the normal position and to prevent this from happening again, I've started to use mesh slings in order to, as a hammock of the implant, to prevent it from descending down on the chest. And sometimes this is combined with some removal of skin, and of course, it can be with an exchange for new implants and or the combination of fat grafting as well. I hope this has been very informative for you, and I thank you again for listening to What's Hot in Plastic Surgery. This is Dr. Kronowitz. Thank you very much.